A proposed class action lawsuit against a major hospice care provider is raising new questions about who is an essential employee. A California sales representative who is suing VITAS Healthcare claims managers wanted her to visit medical facilities despite the pandemic. She says VITAS endangered her and others by labeling its workers essential and sending them to nursing homes and medical offices. Consumer investigative correspondent Anna Werner has been following this story. Anna, good morning.
Good morning, Jerika. Yes, when their lives can no longer be saved, many people go into hospice for comfort care. Now, someone sells that service, but some say their company has been too aggressive in selling during this pandemic.
What's happening is wrong. It's putting people's lives in danger, and it needs to stop.
What Christina Eisenacher says needs to stop are the practices of her own employer, VITAS Healthcare, the nation's largest for-profit hospice company.
I didn't want to speak out, but there was really no choice when people's lives are at stake.
Eisenacher worked as a sales representative, visiting medical facilities to get referrals for hospice patients.
The role really includes visiting doctors and educating them on what the company has to offer.
But in mid-March, Bay Area counties issued shelter-in-place orders due to the pandemic. So Eisenacher says she was surprised when, just a few days later, she got this robocall from her employer.
All VITAS staff are considered essential healthcare workers. Report to work as scheduled. Governor's stay-at-home order does not apply.
Do you think you were essential?
No.
Neither, she says, did some of her clients, who told her,
as a salesperson, you are not essential and you have no business being in a hospital or a doctor's office right now.
So they didn't want you there?
They didn't want us there.
Because of that and her own respiratory problems, Eisenacher refused and some weeks later sued. Kay Van Way is Eisenacher's attorney.
Let's be clear that this is healthcare sales. This is not rendering healthcare services to patients.
Yet text messages we obtained show VITAS salespeople visiting multiple Bay Area nursing homes and doctors' offices during the pandemic. They took numerous selfies with healthcare workers, some bringing gifts of pizza, chicken, or donuts. Under one picture, a rep even wrote, 6 boxes of these made their way into a local nursing home that isn't allowing food in from the outside. A fellow employee texted back, sneaky, sneaky. Another email shows a manager running a weekend referral contest saying whoever gets the most selfies with medical personnel could win. Personnel including nursing home staff, emergency room staff, physicians, or nurses.
You know, my mom and dad are in their 70s. If it was my parents in one of these facilities and I had any idea what this company was doing, I would be outraged.
It's not appropriate.
This former VITAS sales rep, who did not want to be identified, told us her managers wanted her to keep visiting centers with cancer patients.
I'm a danger to them. Even if I have the flu, I'm a danger to them. And so the fact that they continue to ask me to do this when it was not in the best interest of patients, but telling me that it was insane. It was like living in the twilight zone.
She says she tried to get permission to work from home, but later was fired. VITAS would not comment on Eisenacher's case or do an interview, but in a statement it said representatives work directly with healthcare partners to educate them and support hospice care transitions. Our representatives are critical to ensuring access to hospice care for healthcare partners and thereby hospice-eligible patients, making them essential workers in the healthcare system.
Do you believe that this was about providing the best care for patients?
No, because if it was, then why would we be putting patients' lives potentially in danger?
So what do you think it was really about?
Making more money. They're in the business of death. And unfortunately, their employees could have been contributing to more deaths to their benefit.
In a response to the lawsuit filed last week, VITAS said it has not violated any law or regulation and denied the allegations. Anthony?
Yeah, but it does hardly seem essential to make sales calls during a pandemic, Anna. Thank you very much.